growing up, I watched my mom go through breast cancer, and I watched what it did to my family, and I never want to do that to my kids. I don't even want to have the preventative surgery when I'm with my kids because I want to be able to hold them and play with them and run with them.
Kelly Roth has always known breast cancer. As a young child, she watched her mother fight it and ultimately lose the battle.
Well, I was still a young kid when she was diagnosed, and I was still a young kid when she died. So I do have memories of her healthy that my brother and sister don't, but I also have more memories of her sick, too.
I've known the family for a long time because I got to know her mother very well because she was my patient in the around late 90s, around 2000.
Beaumont's Dr. Zakaluk treated both Kelly's mom and her aunt for breast cancer. In her teens, Kelly learned that she had a 50% chance of carrying that same genetic mutation, so she returned to Beaumont and Dr. Zakaluk for genetic counseling.
We need to explain to patients what the genes are. We need to explain to the patients what the pros and cons and potential implications of genetic evaluation and genetic testing may be, because patients need to enter this process really knowledgeable of what the significance of the result will mean.
During counseling, patients are told that in the nucleus of every cell in the human body there are chromosomes. The BRCA1 and 2 genes exist on chromosomes 17 and 13. Normally, these genes help to keep a cell's genetic material on the right track, preventing abnormal cell growth, like cancer, in the breast, ovaries, and prostate. The trouble comes when the BRCA genes mutate, allowing breast and ovarian cancer cells to grow.
But in general, it's fairly rare. It accounts for maybe 5 to 10% of all breast cancers and about 10% of all ovarian cancers. However, the younger a person is with breast cancer, the more likely that we will find it. The risk really starts going up around the age of 30 to 35. So when I disclose a positive result to a woman in her 20s, I tell that woman that in her 20s, the risks of breast and or ovarian cancer is low. It's probably significantly less than 5%. And that the only time that may be less true is if in that family there is someone with breast cancer at a very, very young age. That may tell us that that particular mutation starts younger.
Given her family history, Kelly was not surprised when she tested positive. It confirmed she had an 87% chance of developing breast cancer at some point in her life. The oncology team at Beaumont offered Kelly a host of options that included aggressive monitoring, groundbreaking drug therapies, and preventative surgery.
We do not advise women to do preventative surgery in their 20s simply because the risks are quite low, and we'd like that woman to go through normal childbearing and make sure that she makes that decision at a very mature time in her life so that there's never any regret.
The discovery of the first BRCA gene mutation was made 20 years ago. The mutation can be carried by both men and women, so understanding family history is key. Genetic counselors use a pedigree chart to assess family risk.
If a daughter comes in and she's positive, we definitely recommend her brother's test because each of her siblings, male or female, has a 50% chance of carrying that same mutation that that daughter has. With respect to testing the father, we would only test the father if we suspect that's the side of the family the gene is tracking from. For women who don't have the BRCA mutation, breast cancer starts at an older age, sometime around over age 60, and why breast cancer is triggered with age has to do with exposure to carcinogens, exposure to different spontaneous changes that happen within your tissues, and environmental factors, certainly. The reason BRCA mutation carriers develop breast cancer at a younger age is because you are born, that individual is born with a mutation in BRCA in every single cell, including the breast cell. So you already have a lag up, if you will, on the average individual because you have a change in your DNA that makes that more likely.
To prevent the chance of inherited breast cancer, Kelly chose to have a double mastectomy. And she knows that sharing her story about the value of genetic testing pays tribute to her mother.
When it comes to this and when it comes to dying in that way, I'd rather know.